So today we have the question about idiopathic peripheral neuropathy treatment. And if you've been diagnosed with idiopathic peripheral neuropathy, in essence, the next step that has to be taken is really figuring out the cause of your neuropathy. And you may think, oh, that sounds simple, or my doctor cannot figure it out. And what you need to know is that your doctors are fantastic, but lots of times they are handcuffed by third-party payers in terms of what tests they can and cannot order. And so if you've been diagnosed as having idiopathic peripheral neuropathy, we see a lot of patients who come in with that. Just know that tenacity can really help in these situations, and you may have to work with your doctor and say, okay, what can we do to further test me for these other conditions that I've been looking into? Some of the most common causes of idiopathic peripheral neuropathy do include conditions such as vitamin deficiencies. I'm sure you're aware of that. Post-chemotherapy can cause peripheral neuropathy. Hypothyroidism and thyroid disorders are associated. Believe it or not, wheat and gluten intolerances account for a large percentage of idiopathic peripheral neuropathy cases, as well as the now infamous pre-diabetic state. But with prediabetes, you have to run what's termed an oral glucose tolerance test to really delineate whether you have the condition or not, if you've been told that your blood sugar numbers are normal. And so those are just a few. Another one includes a monoclonal gammopathy of uncertain significance. You can go to powerhealthtalk.com. We have hours on this subject. But before I summarize, what I want to say is that by looking into these detailed tests and working with your doctor, and really just plead with your neurologist, say, hey, I really want to figure this out. The cause of idiopathic neuropathy can often be delineated. In fact, the current estimates are that at least about 76% of the time, in idiopathic peripheral neuropathy, sufferers should know what's causing their peripheral neuropathy. Now, you can go to powerhealthtalk.com, as I detailed before. We have lots of videos, hours of videos on peripheral neuropathy, and we do talk about treatment there because there's a new paradigm in peripheral neuropathy. Many of you have been told there's nothing that can be done for you except to take medications. Well, the new paradigm in peripheral neuropathy that we feel that we're on the forefront of establishing is getting to the underlying cause of the problem. So figuring out what the cause of neuropathy is, trying to correct that. So if you have a B vitamin deficiency, taking a B vitamin is the first step. But then also going back and rehabilitating nerves. Each of these methods have been done independently, but they have not been brought together in an organized fashion. And so we talk about that on our videos, and we recommend you go on powerhealthtalk.com, search peripheral neuropathy, and you will find lots of information on this subject. So thank you for watching. I'm Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor, and we'll see you next time.